Diabetes is a condition in which our body does not properly use glucose, causing it to accumulate in the blood and leading to high sugar levels. You already know that diet plays a very crucial role in diabetes, because the sugar entering our blood comes directly from what, how, and how much we eat. Therefore, it is extremely important for diabetic patients to eat the right things and eat correctly. You may have often heard the song, "Eat lentils and flatbreads, sing the virtues of the Lord." Lentils are often considered food for the poor. But did you know that these lentils are an amazing food for health? Very beneficial indeed. Their marvel lies in the fact that they are rich in protein and fiber, and their glycemic index is quite low. This means they digest slowly in the stomach, so blood sugar levels do not suddenly spike and remain controlled and constant. Let's begin and see what is at number 5. I have arranged the video step by step in a ranking order. We will start with number 5 and eventually move to number 1, which is the best for you. Number 5. Chickpeas. Chickpeas are full of protein and fiber, and their glycemic index is low, around 28 to 33, which places them in the low category. This means that when you eat chickpeas, they do not immediately raise your blood sugar levels but keep them constant. The high fiber content in chickpeas slows their digestion process, so they digest gradually, releasing sugar slowly into the blood instead of causing a sudden spike. Moreover, an interesting study shows that if you regularly eat chickpeas, they can reduce insulin resistance in the body. Insulin is the hormone that helps carry glucose from the blood into our cells. Think of it like this. If your house has a locked door, you need a key to enter. Similarly, your cells are like houses, and the door to let sugar in is unlocked by insulin. If the key, insulin, doesn't work properly, the door won't open, and the sugar remains in the blood, eventually leading to diabetes. Chickpeas not only help maintain your blood sugar but also significantly reduce the risk of diabetes, even in people without high sugar diabetes or those in pre-diabetic stages. There are 2 types of chickpeas, Kabuli chickpeas and local chickpeas. Both are good for diabetes. However, if you compare them closely, local chickpeas are slightly more effective. So, use local chickpeas more if you can, but if you prefer Kabuli, you may use those too. Choose whichever you like. Number 4. Mung lentils. Mung lentils come in 2 types, yellow mung lentils and green mung lentils. In yellow mung lentils, the skin is removed, while in green mung lentils, the skin remains intact. The skin contains fiber, which means technically the green mung lentils are healthier and more suitable for diabetes. However, for variety, you can also eat yellow mung lentils without any problem. The glycemic index of green mung lentils is 38, which is quite low. It is especially beneficial for pregnant women or people with heart problems or general bodily weakness. For diabetic patients, who are at a significantly higher risk of heart disease and high cholesterol, eating green mung lentils 1 or 2 times a week can help lower cholesterol and improve heart health. In cases of diabetes during pregnancy, green mung lentils are highly recommended to be consumed daily. Number 3. Black beans and kidney beans. Black beans and kidney beans are not only very tasty, but also have amazing health benefits. They are a very rich source of protein and fiber, and their glycemic index is only 19, which is extremely low. They greatly help in stabilizing blood sugar. Additionally, they are full of antioxidants, which are beneficial for the eyes, skin, and overall health. When cooking these beans, remember to soak them in water for a few hours before cooking and ensure they are well cooked, as undercooked kidney beans or black beans can be harmful. With this in mind, you can comfortably eat them 2 to 4 times a week and see how much they help control your blood sugar. Number 2. Red lentils. Red lentils are extremely beneficial for diabetes. Their glycemic index is only 25, which is quite low, making them very suitable for diabetic patients. Red lentils are not only a good source of fiber and protein, but also contain iron, B vitamins, and minerals, all of which are particularly beneficial for your overall health, something that is very important for diabetic patients. To prepare red lentils in a diabetic-friendly way, use minimal oil and healthy spices such as cumin, garlic, asafoetida, and turmeric. These ingredients make the lentils even more nutritious, beneficial, and enhance their flavor. When used in this manner, red lentils become an excellent diabetic-friendly food. Number 1. Split chickpeas, also known as split Bengal gram. The best lentil for diabetes is split chickpeas. Their glycemic index is an unbelievable 8, extremely low, so diabetic patients can eat them without hesitation to their heart's content without any worry. Split chickpeas are rich in protein and fiber as well as folic acid, which helps produce new blood cells and strengthens nerves. If someone has diabetes along with weakness, where nerves have become weak or there is a shortage of blood, then split chickpeas are a perfect option that can be eaten freely in the morning or evening as much as desired. Here are a few additional tips. 1. Portion control. For each meal, allocate 50% of your plate to vegetables and salad, 25% to lentils or other items mentioned, and the remaining 25% to flatbreads made of whole wheat or millet. Always choose whole wheat or millet flatbreads as they are best for diabetic patients. 2. Variety is key. Do not depend on just one item. Have a balanced meal that includes some carbohydrates, a little healthy fat, and plenty of proteins and fibers. 3. Know your body. Every diabetic patient's body is different. Understand your body, recognize your requirements, and take the appropriate steps accordingly.
There is a widespread belief that people with diabetes should avoid eating fruits. Many think that consuming fruits can spike blood sugar levels and worsen diabetes. However, this is a misconception. Not all fruits are harmful to diabetics. In fact, some fruits can be highly beneficial when consumed in the right quantity and at the right time. Renowned doctors and health experts emphasize that diabetics should include fruits in their diet rather than eliminating them completely. The key is to choose fruits wisely based on their effect on blood sugar levels. Whenever we consume food, two key factors determine how it impacts our blood sugar. 1. Glycemic index, GI. This indicates how quickly a particular food increases blood sugar levels after consumption. And 2. Glycemic load, GL. This measures both the quantity of glucose present in a food and the speed at which it is released into the bloodstream. Foods with a high glycemic index release glucose into the bloodstream very quickly. As a result, blood sugar levels rise sharply within a short period. For example, if you eat a biscuit and check your blood sugar 30 minutes later, you will notice a significant increase. This is because biscuits have a high glycemic index, meaning they digest quickly, and the sugar is immediately absorbed into the blood. On the other hand, foods with a low glycemic index digest slowly and release glucose gradually, preventing sudden spikes in blood sugar. For instance, if you eat a cucumber and check your sugar levels 30 minutes later, the increase will be minimal. This is because cucumbers take longer to digest and do not rapidly release glucose. While the glycemic index tells us how quickly a food raises blood sugar, the glycemic load considers both how fast and how much sugar a food releases into the bloodstream. For example, some foods may have a high glycemic index, but a low glycemic load because they contain only a small amount of sugar. Other foods may have a low glycemic index but a high glycemic load because they contain a large amount of sugar that is released slowly over time. Take bread, for example. Eating bread won't cause an immediate sugar spike, but as it digests slowly, it steadily increases blood sugar levels over time. This means that even if a food doesn't seem to affect blood sugar right away, it can still contribute to long-term blood sugar elevation. The good news is that most fruits have a low glycemic index and a low glycemic load, making them suitable for diabetics when consumed in moderation. So, here are some general rules to keep in mind. Fruits with a glycemic index below 55 are considered safe for diabetics. Also, fruits with a glycemic load of 10 or lower are ideal for diabetic consumption. However, portion control is crucial. Even healthy fruits should not be eaten in excess. Here are 5 highly recommended fruits for diabetics. First up, we have grapefruit, also known as Citrus paradisi. It has a low glycemic index and a low glycemic load. So why is it good for diabetics? Well, grapefruit does not cause a sharp rise in blood sugar levels. Plus, it is rich in vitamin C, which strengthens the immune system and acts as an antioxidant, reducing oxidative stress in the body. Speaking of benefits, vitamin C helps in collagen production, keeping the skin youthful and healthy. And for heart health, the fiber in grapefruit helps lower cholesterol, reducing the risk of heart disease, a common complication in diabetics. Next on the list, we have cherries. They have a glycemic index of around 22, which is very low, and a low glycemic load. Now, let's talk about the health benefits. Cherries are packed with antioxidants that help the body fight inflammation and improve insulin sensitivity. They also contain compounds that help regulate blood sugar levels naturally. For a recommended portion, a handful, about 40 cherries per serving, is safe for diabetics. Next up, we have the avocado. With a glycemic index that's very low and a glycemic load that's also very low, avocados are truly a superfood for diabetics. You see, avocados are low in sugar and high in fiber, which helps slow down digestion and prevent blood sugar spikes. They also contain healthy fats that improve cholesterol levels and promote heart health. Although avocados are not very common in Pakistan, they are a fantastic choice for anyone managing diabetes. Apples. Their glycemic index is 38 and their glycemic load is about 5, which is very low. Apples contain fiber, vitamins, and minerals that are essential for overall health. Eating an apple in moderation does not significantly increase blood sugar levels. Remember, portion control is key. Eating one apple a day is beneficial, but excessive consumption should be avoided. Plums. Their glycemic index is around 39 and their glycemic load is 5. Plums contain powerful antioxidants that help regulate blood sugar levels. They are rich in fiber, which aids digestion and supports gut health. As with other fruits, portion control is important. A moderate amount is ideal. Bonus. Tomatoes. A controversial but beneficial fruit. Many people do not consider tomatoes as fruit, but for diabetics, they should be treated as one. The glycemic index of tomatoes is very low, and their glycemic load is low as well. Tomatoes are packed with vitamins, minerals, and antioxidants that improve overall health. They help reduce inflammation and regulate blood sugar levels. However, tomatoes contain oxalates, which may contribute to kidney stones in some people. Therefore, they should be consumed in moderation. Always check your blood sugar levels after eating any new food to understand its effect on your body. If your sugar levels increase significantly, reduce the portion size of that fruit or food. If your sugar levels remain stable, you can continue consuming it in moderation. Exercise regularly and maintain a balanced diet. Follow your doctor's advice and take medications as prescribed. With proper management, diabetes can be controlled effectively, and in some cases it may even be reversed. Did you know that over 34 million American adults have diabetes? That's a staggering number. And with 1 in 3 adults having prediabetes, many of whom don't even know it, keeping blood sugar in check is more important than ever. High blood sugar, or hyperglycemia, can lead to serious health complications, including cardiovascular disease, nerve damage, and kidney problems. Fortunately, making small changes to your diet can make a big difference. Let's explore 5 superfoods that can help lower blood sugar naturally. Berries, tiny but mighty. Berries aren't just delicious, they're packed with nutrients that help manage blood sugar levels. Blueberries, strawberries, and raspberries contain fiber and antioxidants that reduce inflammation and improve insulin sensitivity. One study found that strawberries could reduce diabetes complications like kidney disease and nerve damage. Another study in obesity discovered that increasing raspberry intake led to a decrease in insulin resistance. Additionally, berries have a low glycemic index, meaning they cause a slower rise in blood sugar levels compared to other fruits. The anthocyanins found in berries have been shown to enhance insulin sensitivity, reducing the risk of blood sugar spikes. To maximize the benefits, try pairing berries with high-fiber foods like oats or chia seeds to slow sugar absorption even further. Nuts, a crunchy, satisfying snack. Snacking on nuts like almonds, cashews, and pistachios can be a game-changer for blood sugar control. Research shows that pregnant individuals at risk for gestational diabetes had lower blood sugar after consuming pistachios compared to those who ate whole wheat bread. And for the rest of us, just a quarter cup of nuts per day can lower BMI, reduce diabetes risks, and improve heart health. Nuts are rich in healthy fats, protein, and fiber, making them an excellent choice for stabilizing blood sugar. They also contain magnesium, a mineral that plays a role in insulin regulation. Walnuts in particular contain alpha-linolenic acid, an omega-3 fatty acid that supports heart health. To make the most of their benefits, opt for raw or dry roasted nuts without added salt or sugar. Leafy greens, a powerhouse of nutrients. Spinach, kale, collard greens, and other leafy vegetables are packed with magnesium, which helps lower the risk of type 2 diabetes. They're also loaded with vitamins A, C, and E, plus iron and calcium. Greens offer a double benefit. They help relax blood vessels, lowering blood pressure, while their fiber content aids in glucose management. A study published in the British Medical Journal found that increasing leafy green consumption significantly reduced the risk of developing diabetes. The fiber in greens slows digestion and prevents sudden blood sugar spikes. Whether in a smoothie, salad, or stir-fry, these greens are a must for a balanced diet. Try adding a handful of spinach to your morning omelet or blending kale into a fruit smoothie for an easy nutritional boost. Non-starchy vegetables, versatile and blood sugar friendly. Not a fan of kale? No problem. The American Diabetes Association suggests filling half your plate with non-starchy vegetables like asparagus, broccoli, green beans, squash, and mushrooms. These veggies are low in calories and carbohydrates while providing essential nutrients like vitamin C, potassium, and antioxidants that support metabolic health. Studies have shown that fiber-rich vegetables can help slow down glucose absorption, keeping blood sugar stable. Cruciferous vegetables like broccoli and Brussels sprouts contain sulforaphane, a compound that has been linked to improved insulin sensitivity and reduced oxidative stress. If opting for frozen or canned versions, go for the no-salt added variety or rinse off excess sodium before eating. Try roasting Brussels sprouts with olive oil and garlic for a delicious nutrient-packed side dish. Refined carbohydrates can spike blood sugar levels, but whole grains provide a smarter alternative. Oats, quinoa, brown rice, and whole wheat are packed with fiber, folate, chromium, B vitamins, and magnesium. These nutrients help regulate blood sugar while keeping you full longer. A study published in the American Journal of Clinical Nutrition found that individuals who consumed whole grains regularly had a lower risk of developing type 2 diabetes. Whole grains have a lower glycemic load than refined grains, meaning they cause a gradual rise in blood sugar rather than a sharp spike. To incorporate more whole grains into your diet, swap out white rice for quinoa, or enjoy a bowl of steel-cut oats with cinnamon and nuts for breakfast. Final thoughts. Managing blood sugar doesn't mean giving up delicious foods. By incorporating these 5 superfoods into your diet, you can naturally lower glucose levels, reduce your risk of diabetes, and improve overall health. Remember, small dietary changes can lead to big health benefits, so why not start today? Additional tips. Stay hydrated to help your body process glucose more effectively. Engage in regular physical activity to improve insulin sensitivity. Limit added sugars and refined carbs to avoid unnecessary blood sugar spikes. Monitor your blood sugar levels regularly if you're at risk or have been diagnosed with diabetes. Have you tried any of these superfoods? Let us know in the comments which ones are your favorites, and don't forget to share this article with friends and family who might benefit from these simple but powerful dietary changes. Did you know that some vegetables can lower your blood sugar as effectively as medication? That's right. Managing diabetes isn't just about avoiding certain foods, it's also about incorporating specific vegetables that actively regulate blood sugar levels. These vegetables play a crucial role in balancing glucose levels naturally, and might be one of the best-kept secrets in diabetes management. Today, we'll dive into the top 5 vegetables scientifically proven to help control blood sugar. Stick around because at the end, we'll also share some high-carb vegetables you should watch out for. But first, could you do us a favor? Like this video, subscribe for updates, and share it with anyone who could benefit. Number 5. Carrots. Carrots often get a bad rap because of their natural sweetness, but don't let that fool you. They are actually low on the glycemic index, meaning their sugars are released slowly into the bloodstream, preventing the spikes diabetics work hard to avoid. Carrots are rich in fiber, which slows digestion and stabilizes blood sugar. One of the standout nutrients in carrots is beta-carotene, a precursor to vitamin A, which is crucial for eye health, a major concern for diabetics at risk of diabetic retinopathy. Research published in the British Journal of Nutrition highlighted that individuals with high beta-carotene levels have a reduced risk of developing type 2 diabetes. Additionally, beta-carotene acts as an antioxidant, reducing oxidative stress that contributes to insulin resistance. Carrots are also high in potassium, which helps regulate blood pressure, another key issue for diabetics. Whether eaten raw, steamed, or roasted, carrots are more than just a crunchy snack. They're a powerful ally in diabetes management. Number 4. Avocados. Like tomatoes, avocados are technically fruits, but due to their savory taste, they're often considered vegetables. Avocados are a diabetes superfood because they contain healthy monounsaturated fats, which improve insulin sensitivity and help regulate blood sugar. Their high fiber content slows digestion, leading to a controlled release of glucose into the bloodstream. Plus, avocados help lower LDL cholesterol, the bad kind, while maintaining HDL cholesterol, the good kind, reducing the risk of cardiovascular disease, a common concern for diabetics. A study in the American Journal of Clinical Nutrition found that consuming healthy fats like those in avocados reduces insulin resistance and inflammation. Additionally, avocados contain folate, which plays a role in heart health, and magnesium, which helps regulate muscle and nerve function, including blood sugar levels. Enjoy avocados in salads, smoothies, or as a spread to enhance your meals while keeping your blood sugar in check. Number 3. Spinach. Spinach is a low-carb, high-fiber vegetable loaded with magnesium, a crucial mineral for insulin regulation. Studies show that low magnesium levels are often linked to insulin resistance, making it essential for blood sugar control. Another key benefit of spinach is its potassium content, which helps regulate blood pressure, an important factor for diabetics. Research in the American Journal of Clinical Nutrition found that higher potassium intake leads to improved blood sugar regulation and reduces cardiovascular risks in diabetics. Additionally, spinach contains alpha-lipoic acid, an antioxidant that improves insulin sensitivity and may even help regenerate nerves affected by diabetic neuropathy. This is particularly important for individuals experiencing numbness or tingling in their extremities due to prolonged high blood sugar levels. Whether eaten raw in salads or cooked in stews, spinach is a must-have for balanced blood sugar control. Number 2. Brussels sprouts. Brussels sprouts are packed with alpha-lipoic acid, the same powerful antioxidant found in spinach that improves insulin sensitivity and helps combat diabetic neuropathy. They also contain fiber, which slows the absorption of carbohydrates and helps prevent blood sugar spikes. A study published in the Journal of Diabetes Research found that participants who added Brussels sprouts to their diet had improved post-meal blood sugar levels. Plus, these cruciferous vegetables support liver detoxification, which is essential for maintaining stable glucose levels. Brussels sprouts are also rich in vitamin C, an antioxidant that helps reduce inflammation, which is a common issue for diabetics. Additionally, they provide vitamin K, which plays a role in bone health and blood clotting, important factors for long-term diabetes management. Number 1. Broccoli. At the top of our list is broccoli, one of the most powerful vegetables for blood sugar control. Broccoli contains sulforaphane, a compound with proven benefits for enhancing insulin sensitivity and reducing oxidative stress, which can lead to diabetes complications. Research published in Science Translational Medicine found that broccoli extract could lower fasting blood glucose levels by up to 10% in people with type 2 diabetes, an effect comparable to the diabetes medication metformin. Beyond sulforaphane, broccoli is rich in vitamin C, which fights inflammation and strengthens the immune system. Plus, its high fiber content ensures a slow glucose release, preventing sudden blood sugar spikes. For anyone serious about diabetes management, broccoli should be a staple in their diet. While many vegetables are excellent for managing diabetes, there are some high-carb options that should be consumed in moderation, including peas, butternut squash, parsnips, corn, and potatoes. These vegetables, while nutrient-dense, can cause quicker spikes in blood sugar due to their higher starch content. Conclusion: managing diabetes isn't about deprivation, it's about making smart choices. By incorporating these 5 powerhouse vegetables into your diet, you can naturally regulate blood sugar and improve overall health. Managing high blood sugar can sometimes feel like an uphill battle. But what if your everyday kitchen spices could lend you a helping hand? Today, we're exploring how 8 common spices not only add flavor to your meals, but may also support better insulin regulation and blood sugar control. Let's dive into the science behind these spices and learn how to incorporate them into your daily routine for optimal health. Cinnamon isn't just a winter favorite, it's celebrated for its powerful effects on blood sugar control. Studies suggest that cinnamon can mimic insulin's effects and boost its sensitivity. Even a small sprinkle might help your body use insulin more efficiently, lowering fasting glucose levels and improving sugar regulation after meals. How it works. Compounds in cinnamon help stimulate insulin receptors, enhancing glucose uptake by cells. Cinnamon may inhibit digestive enzymes, slowing carbohydrate breakdown and reducing post-meal sugar spikes. Rich in polyphenols, it combats oxidative stress, which is linked to insulin resistance. Here are some practical tips for incorporating cinnamon into your daily routine. In the morning, try adding a cinnamon stick to hot water or herbal tea. And don't forget, you can sprinkle ground cinnamon on oatmeal, yogurt, or even blend it into your smoothies. It's a simple way to enjoy its benefits. Turmeric is truly the star of golden milk and curries. Its active compound, curcumin, is well known for its anti-inflammatory and antioxidant properties. These are essential in combating insulin resistance and improving glucose metabolism. Let's dive into how turmeric works. First, it has anti-inflammatory properties that reduce inflammation in the body, which can enhance insulin sensitivity. Secondly, it supports the liver, potentially helping to lower fasting blood sugar by inhibiting excessive glucose production. Lastly, pairing turmeric with a pinch of black pepper significantly boosts curcumin absorption. So it's quite effective when used correctly. Here are some practical tips for incorporating turmeric into your daily routine. First, you can prepare a warm cup of golden milk with turmeric milk or a plant-based alternative, a dash of black pepper, and a touch of honey. Another idea is to stir turmeric into curries, stews, and salad dressings for an extra nutritious flavor boost. Ginger has been used for centuries to support digestive health. Modern research now shows its potential in balancing blood sugar levels, thanks to bioactive compounds like gingerol and shogal. Let's talk about how ginger works. First, it helps with carbohydrate modulation. Ginger's compounds slow down the breakdown and absorption of carbohydrates, reducing post-meal sugar spikes. Additionally, its powerful anti-inflammatory properties help reduce systemic inflammation, which is a contributor to insulin resistance. Practical tips: grate fresh ginger into stir-fries, salads, or even smoothies. Brew a soothing ginger tea by steeping slices in boiling water for 10 to 15 minutes. Fenugreek seeds are staples in many Indian and Middle Eastern dishes. They are rich in soluble fiber, which slows the absorption of sugars into the bloodstream, promoting stable blood sugar levels. How it works. The high soluble fiber forms a gel-like substance in the gut, delaying carbohydrate digestion and absorption. Fenugreek may also boost insulin secretion from pancreatic beta cells, supporting overall blood sugar regulation. Practical tips for using fenugreek include soaking the seeds overnight and adding them to yogurt or smoothies. You can also use ground fenugreek in curries and spice rubs for an extra nutritional punch. Garlic is known for its robust flavor and may also help manage blood sugar. Its bioactive compounds can improve insulin sensitivity and reduce fasting blood glucose levels, while also supporting heart health by promoting healthy cholesterol levels. Here's how garlic works. Its compounds enhance the cellular response to insulin, improving glucose uptake. Additionally, its natural antioxidants help combat oxidative stress associated with insulin resistance. Practical tips: mince garlic and add it to stir-fries, roasted vegetables, or mix it into salad dressings. Roast garlic to mellow its flavor and use it as a spread or in soups. Also known as black cumin or kalonji, black seed has a long history in traditional medicine. Research suggests that its active component, thymoquinone, may help improve blood sugar control and reduce insulin resistance. How it works. Anti-inflammatory and antioxidant. Black seed's compounds reduce inflammation and oxidative stress, contributing to improved insulin sensitivity. Sugar regulation. It may directly influence enzymes involved in glucose metabolism. Practical tips: sprinkle a pinch of black seeds on salads, yogurt, or baked goods. You can also incorporate them into homemade bread recipes for a nutty, spicy flavor. Cayenne pepper is not only known for adding heat to meals, it contains capsaicin, which may boost metabolism and improve insulin response. How it works. Capsaicin can increase energy expenditure and fat oxidation, indirectly supporting better blood sugar control. It may also improve the body's response to insulin, leading to improved glucose uptake. Practical tips: add a dash of cayenne pepper to soups, stews, or marinades for a spicy kick. Sprinkle it on roasted vegetables to add both heat and nutritional benefits. Cloves are small yet powerful. Rich in compounds like eugenol, cloves have been linked to improved insulin sensitivity and lower blood sugar levels. How it works. Insulin enhancement. Bioactive compounds in cloves may boost the effectiveness of insulin-lowering blood glucose levels. Digestive aid. Cloves support healthy digestion, which can further stabilize blood sugar after meals. Practical tips: steep whole cloves in hot water to make a warming, aromatic tea. Add a pinch of ground cloves to baked goods, smoothies, or sprinkle on fruit for a touch of warmth. For a simple and delicious way to incorporate these blood sugar-friendly spices, try this cinnamon ginger tea recipe. Ingredients: 1 cinnamon stick, 4 to 5 slices of fresh ginger, 2 cups of boiling water, optional, a squeeze of lemon and a dash of honey. Place the cinnamon stick and ginger slices in a teapot or large mug. Pour boiling water over the ingredients and let steep for 10 to 15 minutes. Strain the tea, add lemon or honey if desired, and enjoy it warm. This comforting tea not only supports stable blood sugar levels but also boosts metabolism and aids digestion, all while delighting your senses. Incorporating these 8 everyday spices into your diet is a natural, flavorful way to help manage high blood sugar and support overall metabolic health. Remember, consistency is key. Small changes in your diet can lead to significant benefits over time. Always consult with your healthcare provider before making major changes, especially if you are managing diabetes or other chronic conditions. If you found this video helpful, please like, subscribe, and click the notification bell for more expert health tips and natural remedies. Here's to a healthier, more flavorful life, one spice at a time.